The most news in the morning. CNN's American Morning. Weekday, 6 a.m. Eastern.
War strategy in Afghanistan and President Obama's failed Olympic bid may have stolen the headlines, but beneath the surface, the health care debate rages on this week. And former Senate Majority Leader Bill Frist has some strong opinions on what's going on in Washington. Here to talk about his views, which may surprise you, in his new book, which is called A Heart to Serve, is Dr. Bill Frist. Thanks for joining us this morning. Good to see you. You said not too long ago that if you were still in the Senate, you would probably vote for health care overhaul.
Transformation of the health care system today.
What exactly is it, though, that you would feel comfortable voting for? Any of the plans that are out there now?
Two things. And again, these next 2 or 3 weeks are critical. We got to bring people together to get it done. It's a great moment in time if it can be done. Number one, we've got to get the uninsured into the market itself. There's too much cherry picking going on. There's too much adverse selection. There are 46 million out there. There are 20 million who are hardcore uninsured who just can't get it because they can't afford it. So I'd start there, but eventually we need to get them all into the insurance market. We just don't have enough money to do it right now, but 20 million hardcore. Number two, it's the cost in health care. And basically, health care costs are going up 3 times faster than inflation. And your typical person out there simply can't afford it any longer. $15,000 policies being the average for a family of 4 is too much, but it's going up too fast. So the health care reform that we need is something that brings in as many as we can, I'd say 20 million now, that addresses issues, the spending by putting benefits out there with competition on the marketplace, eliminating the about 30% waste in health care, and that can be done through information technology and transparency and accountability. And if we can do that, we can both afford it today and bring people into the market itself.
So let's zero in on this idea of competition in the marketplace. Many Democrats believe the way to really get competition in the marketplace is to put forward a public option, which would have a government-sponsored health insurance program out there competing with the other ones. Right. Would you support that?
A public option as a backup that is not federally controlled, but is controlled at the local level with local ownership.
So you're talking co-ops?
It can be a co-op, but even the co-op people, it's kind of a new concept. But the idea of not having government out there controlling prices out there, undercutting the insurance market, and that's the big fear. And at the end of the day, you're going to have some sort of a backup of a public plan. And at the end of the day, if the private sector doesn't step up, you're going to have some other kind of a trigger coming into it.
So you're talking about Olympia Snow's idea of a trigger?
What we did in 2003 with the Medicare Modernization Act, which was the prescription drug plan. If the private sector does not step up, and there's not more than 2 plans there, a public plan that has local control, local and private implementation has to step in.
So it sounds like the plan that's being written in the Senate Finance Committee is something that might attract your vote.
Well, I'm coming out very strongly in support of what's going on in the Senate Finance Committee. It's bipartisan. I hope that it ends up being bipartisan. If not, I think it's going to be a destructive bill. But it's bipartisan, people working together. So we're on the way there. I would not endorse the bill the way it is now. There's still about 400 amendments out there, so hopefully that process can come together.
Now we should say that you and I saw each other just a couple of weeks ago at the U2 concert at the Giant Stadium, and we were talking health care.
Yeah.
Shows you, how all-consuming this is. We're at a concert, we're talking health care. And you suggested that you didn't think it was such a great idea to do this all at once, that you could do pieces of it.
Well, the problem we have today, and actually I write about it in my book, A Heart to Serve, is that in a time of recession and job loss, when we have really 46 million or 20 million people out there, we simply can't afford to promise them a Cadillac gold-plated type plan, and that's what's being done today. There are too many mandates out there. It's too expensive. We simply can't do it. Taxes go up, premiums go up. It can't be done. Thus, what you can do is, yes, get universal care, but not promise everybody everything. And one thing you can do is do it like car insurance and make sure that we have at least catastrophic coverage. So you can look people in the eye and say, you are not going to be driven to bankruptcy if your child gets leukemia, for example.
Right. I want to talk about a couple of things in your book, which you say is not a political memoir. It's a story about leadership lessons learned and lived, or lived and learned. And talking about you, too, you write about the time that you spent in 2001 with Bono in Uganda, going around the country, just 2 guys. You didn't take any cameras with you, as he did when he traveled with Paul O'Neill, the former Treasury Secretary. What was that experience like?
One of the fun things about writing a book like this, as you said, not a political memoir, it's about a third stories in health care, about a third on global health issues, the sort of stories like with Bono, and a third is on experiences in the Senate. And it was written to inspire people to get involved in their communities. But I did put stories like meeting Bono, sort of serendipitously, very quietly. We did go to Uganda to see if the policies the United States had in place were really working.
Right.
So no cameras, no constituents, no security, and no rock star fans. We were there. And out of that came eventually legislation, the HIV legislation, that means about 23 million people are going to be treated for HIV.
And we should mention, too, that he gave you a shout-out at Giant Stadium and again in Washington, and you were at both shows,
and
right?
we've worked very closely on things like the Millennium Challenge Corporation, which is a way to give development aid in a very responsible way instead of just throwing it away. So people like him who give voice to very sort of accountable, transparent issues, I think have a huge impact on global health and health here at home.
Now, that's a story that I knew, that you went to Africa with him, and we actually talked about that a couple of weeks ago. A story I didn't know, which I was fascinated to find out by reading this book, is that in 1991, you saved then Lieutenant Colonel David Petraeus' life.
Yeah. Yeah, and again, this is a sort of a lesson in service and in part leadership, but mainly service, that things come full circle. And indeed, in 1991, when I was at a soccer, long before politics for me, long before he was a general, the famous general that he is today, but I got word that there was a life flight helicopter coming in with somebody dying, shot through the chest with an M16, blew out his back, took out the top of the lung, hemorrhaging. And I went into the hospital and opened up his chest widely, put my hands around his lung, and stopped the hemorrhage. And really 2 days later, he was up walking around.
So he wouldn't
tough
be,
guy.
He wouldn't be where he is today if it weren't for you. Then.
Well, it was not necessarily me. I happened to be the surgeon on call. I was the tool. I was the instrument. It would have been another trauma surgeon. But it is ironic. Long before politics, long before he was in Iraq, Afghanistan, and the like, we come full circle.
That was an accidental shooting. But what's fascinating to me as well is that he insisted that he get back to Fort Campbell 2 days after the surgery.
And 5 days after, he insisted, which I didn't like because of this incision, doing push-ups with his soldiers.
So he is a pretty tough guy.
Well, those are the kind of stories that are in here, really, in sort of the back room, the inner workings of the United States Senate, encouraging everybody to find their own passions, get out there, involve, develop them so they can be of service to their communities.
Well, it's a great book, and it's great to see you this morning. Thanks for stopping
John,
by.
great to be with you.
Really
Thank you.
appreciate it.